Dr. Beck, lots of people suffer from lower back pain. Some of us hurt ourselves. We do sports, we do lifting, we do all kinds of things. I once hurt myself lifting a not very heavy suitcase in Italy. But lifting it in a lazy way, in a way I shouldn't have lifted it. I know so, but hey, you're there, you want to throw things into in a macho way, your car, and next thing you know is you get a little pain. But there's also the just normal deterioration from standing a certain way. I have friends who work on machineries all the time because I'm from the machinery engineering. Every one of them has lower back pain. Every one of them, because all day long, 8 hours, they stand somewhat bent. Very little bent, but somewhat bent. What can be done there? And is that something which a medical doctor and a doctor who is heavily involved with nerves like you, can help with?
Well, we can, and as I always tell people, when in doubt, check it out. First thing you want to do is find out what's causing your pain, because particularly with low back pain, there can be a number of medical conditions that can mimic low back pain, and some of them can be very serious, and you don't want to miss those. So don't just assume it's a simple lumbar strain or sprain. You need to go in and get a good checkup by your doctor, where he'll check you out, he or she will check you out, take a good physical examination, and then if necessary, order some tests to make sure you know exactly what is causing the pain.
Okay. And what are some of the things which can cause the pain? You gave us a good idea of what can cause it in the neck and shoulder. What about the lower back pain? What are some of the things which cause it?
The lower back pain is pretty similar to the neck. There's probably three main reasons why you could have pain, common reasons. One is, like you said, you strained the muscle, you picked up something the wrong way, and you've torn some muscle or torn some ligaments. And, it's like pulling a hamstring muscle. It's something that's probably going to need a therapeutic exercise and possibly modalities like heat and cold to make it better. The second case would, like the neck, be a ruptured disc in the back. Now, the other thing that goes with the ruptured disc is what we call degenerative changes in the back, and this is where the disc actually sort of collapse down. You get arthritic changes in the back, and some people refer to it as degenerative disc disease, and really this is a function of aging. The back gets older, the discs dry out, they kind of slump down, and so that's another possible cause. And then the third cause would be something where you have a pinched nerve in your back, which is causing pain to go down your legs. And that's also usually caused by a ruptured disc, although it can be caused by arthritis as well. Now, getting back to the medical conditions,
the pain down your legs, would that be sciatic pain?
Yeah, that's what people really usually call it. That pain, it kind of zips down the back of your leg. It's sort of like electrical shock. Frequently, you get tingling and funny feelings in your leg. That would be called sciatica.
But it really actually gets caused in the lower back.
It can be. It can also be caused by the sciatic nerve getting pinched in your hip, where you get real tight hip muscles, and that can also send pain down your leg and actually be identical to the kind of pain caused by a pinched nerve in your back from a ruptured disc.
Okay. All right. So what are the treatments available, or what are even, let's go a step further, what are the detection methods available to see what is what, right?
Well, the first thing is to have somebody look you over and make sure you're not got a more serious medical problem such as prostate cancer or a blood cancer where it's gone into the bones of your back. That's the one thing I usually worry about. Once you make sure there's not something serious going on like that, you may not need any tests. Typically, we'll use tests like X-rays. Sometimes we'll do an MRI scan to see if there's a ruptured disc in the back. And in more difficult cases, we'll use what's called a bone scan, where they actually inject radioactive dye into your veins to see if there's any what we call hot spots in the bones that are causing your pain. And so those are some of the typical things. But the best thing is to start out with is your doctor talking to you and doing a really thorough physical examination.
Okay, I see. But isn't it that, isn't that what many patients complain, that the doctor doesn't really find what is? They go to a chiropractor, they go to a MD, and they don't really find it. So is there, should the patients be alert to where he goes to, that a person who constantly looks for that, not just to any, I don't know. it looks to me that from what you mentioned that the diagnostic aspect of it is a rather important one.
Yeah, it is. And if your doctor doesn't actually put his hands on you and check you out, you probably need to go somewhere else for care, because that means they're not really doing their job. And this is the biggest complaint I get from patients is my doctor didn't even touch me, so how does he know what's going on? And so if you're not putting your hands on your patient, you're not spending time to talk with them and figure out what's going on, then you're probably not going to figure out what's going on. And so that's the key thing, is to spend a little bit of time with your patient to find out what's wrong with your patient. And again, if your doctor's not doing that, then you may need to go find somebody else.
Mm-hmm. Okay. And like a nerve specialist like you, somebody who works right with nerves, so you also said something that in the neck you used something like a ultrasonic thing. Is that also applying for the back to figure it out or not?
Yeah, we do. We can guide injections with the ultrasound machine. That's like what they check out pregnant women with. We also can do, like I said, injections into the muscles and ligaments, into the joints. And we can also do nerve testing to determine if indeed you have a pinched nerve in your back.
The nerve testing, the injections, whatever is in there, into the muscles, again, is that something every normal MD is doing, or is it usually people who specialize in that type of injury or in that type of symptoms?
Yeah, these type of procedures are typically done by a board-certified specialist. I'm not aware of any, general practitioner that does those type of procedures.
I got it. Okay. Well, all right. Anything else you think people should know about? And again, what would you say that like people who have been told that you have lower back pain, surgery is the way to go, which was and just about every normal MD, will on an average refer you to a surgeon who then of course finds out surgery. What would you say, again a good average, out of 10 or out of 100 people coming in who actually consider surgery who really don't need it?
Oh, I would say 80 to 90% don't need the surgery. And, if you look at statistics and the research, the one treatment that has been shown over and over again to be effective for back pain and neck pain is exercise. And this is unfortunately one of the few treatments most doctors, particularly surgeons, don't recommend. So there's some very simple things you can do, and I've seen a lot of people who were told they needed surgery. We've done, these exercises, injections, and used medications, and they've done quite well with that.
You mentioned something about when you in the shoulder and neck about stretching, kind of like stretching the neck from saying with whatever machine or whatever it is you do. A similar thing for the lower back pain, similar thing for the lower where you pull the little spines or whatever you call those things apart and.
Unfortunately, for the back, what we find is it's much more difficult to get the vertebra to pull apart because the muscles are so thick and so strong, and the ligaments are so thick and so strong in your back that it's really, you have to put tremendous amounts of weight on a person to actually get that to pull apart. Whereas your neck is much less muscle, much less ligaments, and it'll only take 15, maybe 20 pounds to do that. Whereas in your back, it would just take an excessive amount of force to do that. And so we can do stretching of the back, but the decompression or pulling apart is something that's a little less likely to be a benefit in the back.
Okay. All right. Thank you very much.
Good. Thank you.